perfect. I sat there nicely. I went to bed with stomach. I don't know what. Alex, can you hear me? I'm just trying to get Alex's attention. Maybe have his mic. He might have his mic off, so hopefully you can hear me. So we'll start off. We're doing a appendicular skeleton today. We did the axial skeleton last time we were together. And if you remember, the axial skeleton includes this V formation, right? The center part here. It does not include these two iliac crests. It does not include the clavicles either. All of the skull bones that we reviewed the other day, I'm going to be sending you out a keyword study, and it will have a list on there of the bones that I would like you to study. The bones that we didn't really cover the last time we were here were the ossicles, and the ossicles are the auditory ossicles, and I'm not sure if Alex, you can see this, but if you go to your Moodle site, you can find all these. So the auditory ossicles are just the malleus, which is this one here, the incus and the stapes. The stapes is easy to remember because it looks like a little, kind of like a little stirrup on a saddle. So just to review those and remember that they are in the skull, of course, where your ears are. We'll go through those, have a look at those. I've handed out some information to the students that are here, and I will send it to the other students. This is more or less a, it's for body mechanics, and it has, and you can see here that it is called stable, and it just shows the curvature of your spine and the support systems. And on the back of this, and I'll send this to the students as well, it's lifting techniques. And this, of course, is more along the nursing part of this than the biology part of it, but it's very important that you're aware of these. So just to go back again to do some more, a little bit more review, go back to the integumentary, and we're going back to the rule of 9. And if you can remember what that is, it is for burns. So hopefully you have a diagram that gives you what the percentages in the rule of 9. You will see the rule of 9 again, so I just want to remind you of that. If you had a person coming into the emergency department and they have burnt both of their thighs, the leg part, and they had burnt the genital area, how would you decide how much they had burned? Because each thigh, go ahead, Daniel. Okay, each thigh is 9%, right? So we've got 9 and 9%, so you get 18%. And then you add the percentage of the genital area, so it's got 19% burns. It doesn't qualify what type of burns they are, meaning are they first, second, or third degree? It just says that's the body surface that has been burnt. So if you remember your first degree burn, remember what that is? Just the top layer of your epidermis, that's your sunburn, right? So it's a second-degree burn. I'm sorry. Okay, so your second degree is going to be blistered for sure, right? You're going to have that, you're going to lift off the epidermis, you're down into the dermis now. It's going to damage the hair follicles, it's going to damage the sweat glands and the sebaceous glands where the oil glands are. So it'll do that type of damage. And remember we talked about the nerve endings, so where the nerve endings are, whereabouts are they? They are in that dermis, right? Okay. So this person with a second degree burn is going to have a lot of pain because those nerve endings have been exposed and they're very painful. So pain is the first thing that's going to alert you to which layer that. The third degree burn, which is a complete burn, it's called a full thickness burn. That is down to where? Right down to the muscle, the bone. That's right. Thanks, Brenda. So that is called a full thickness burn. And the other two, the first and second degree burns, are called partial thicknesses. So just want you to just put that in your memory bank somewhere. So I just wanted to review that for you. So we'll go on to, I think that's all the review I have for you today. So we're going to go on to the PowerPoint, and I'm going to be interrupting the PowerPoint along the way so we can talk more. Okay, we have that up. Awesome. Okay, so we're talking about appendicular skeletons, and I actually had this nice little costume. That's awesome. And I was going to put it on, but to tell you the truth, I was just feeling a little uncomfortable without it, so I didn't put my costume on. It would have been perfect, so I might put it on later. I should run and put it on. You should. Take a break, run and put it on. Seriously, I will if you want me to. You should. Well, it's actually really good because I can actually talk about the different bones as we go, because they're on here. So that's kind of neat. So anyways, so just grab a drink of tea or something and I'll go bring that. So awesome. Yay. I think this is really class I get excited. Look, the lineup was shady. I know, and I swear they move forward. They do. They just put the same, and you know, all just one learning, I only had coffee. I know, there was no reason why they should have been. My girlfriend and I went to a window and I was get too milk and too sweetener, and then they ran out of milk. And then how I know it was going to take you time at 7 minutes. I would have just had to sweetener and then call it a day. What happened in 7 minutes? Then they get kind and all of that, so I don't know why. Like when I worked there, they had everything less than 30 seconds, and I don't know what it was. Like it's out the window gone. And I think at ours, it was like we had, I think we won the $10,000 or something like that, divided between the workers and you get a bonus. So obviously, and it drives me crazy because at Starbucks, if you have ice work and if you have to wait for so long, then they'll just give you your and I don't know why they do that. They don't do that in vaccines or nothing like that. What time would be last night that? Oh, I'm supposed to. I have to show Alex. Ta-da! We can't see much of it. I'll have to stand on a chair to show it to him. Anyways, you can buy one of these at Walmart if you wish. If you want to work from home. Anyways, here we go. Sorry for the interruption. What's that? So my mom would love it. She loves costumes. I do too. I have a lot of Halloween fun. Okay, so here you have a nice diagram of the appendicular skeleton. I've tried to enlarge it as much as I could on the PowerPoint. So like I was saying when we talked about the axial skeleton, those two iliac crests are not included, and neither are the clavicles. Okay? Does anybody remember much about the axial skeleton? What is it used for? Mostly support, right? It gives you a lot of support. It supports your body and your appendages, which are means the appendicular skeleton supports that. And also, it protects, right? The axial skeleton protects. All of your really important organs are in there. Your kidneys, your liver, and heart, lungs, spleen are all tucked up inside. The organs that are below that, like the stomach and the intestines and the bladder, though they are important, you can survive. You know, if you lose some of your intestine, you lose a portion of your bladder, you can survive. But these organs that are inside the axial skeleton are the ones that are vital organs. You couldn't live without them, right? So that's why they're so well protected. Okay, so the appendicular skeleton, of course, includes all of the bones that are outside of the axial skeleton, all the bones that you use for movement and motion. Now, when it comes to remembering which ones that you're supposed to memorize, I wouldn't worry too much about it. We will talk about it. Try and remember the major bones, like your clavicle, scapula, and this picture is in your textbook, right? So you can go through that. So the clavicle, scapula, the humerus, which is your large bone here, and on our skeleton, this one right here. Your ulna radius. So the ulna is on the inside. If you were to hold your arm out straight, your ulna would be on the inside. And as you turn, the radius is on the outside. Now you will get, when you take a pulse on the person, you will be taking a radial pulse, right? So it's right over top of this twisting part of the radius. So they do turn, which is awesome. The carpal bones, remember carpal bones are all these little tiny ones. I don't have any hands on this costume. But these are the ones that are in here in the hand. These tiny little guys, right? The metatarsals are next. So those would be these longer ones that are here. And the phalanges are at the end. That's a French word, so it's a little hard to pronounce. And the phalanges have a proximal, this middle and distal. So there's 3 of those in there. So you get proximal, the middle, and the distal. Distal is always at the end. The word distal means at the end. Have you guys been taking that yet in your course? The planes and all? Not yet. Okay. That's okay. You'll get to it. So they talk about so those ones, so these ones right here are the ones you should remember. So clavicle, scapula, humerus, radius, ulna, the carpal bone, metacarpal, and the phalanges. So you will have to know those ones. Just remember the name and kind of where they are. Now this is the ilium. As we talked about this part right here, this is the ilium, right in there. And for some reason, they're calling it the hip bone. But really, the hip is right in here. They're calling it hip bone in this diagram. I'm not really sure why. Anyway, so then you have the femur, which is the longest and sturdiest bone in your body. And do you remember from the osseous that we learned it's got more vascularity, right? It has more vessels that are supplying it with blood because it is such a long and a very thick and strong bone. So that's the femur. So your patella, you all know the patella, that's your kneecap. It just sits on top there. Patellas are more for protection, right? They're just if you bang your knee, and that protects that knee joint. The tibia, which is the bigger one of the two. The tibia is the large one. Right here. Looks like I have to hold it up so else can see it. So this long, very, very hard bone. And if you
run your fingers down your calf, you can actually feel that bone. That's the bone you're feeling. And it has little notches on it. You can feel some little lumps. And that's just kind of damage over the years. And I've got all of them. The fibula, which is beside it, which is the supporting bone for the tibia, it is, like I said, the supporting bone, and that's the one that I broke. So that's it. So below that, then you get the tarsals. So remember, you've got the carpals up here. Now you have the tarsals down here. The only way I remember the difference between carpal and tarsal is tarsal starts with T, so that goes for toes. So the tarsals are down here. So you've got the metatarsals and the phalanges again. You almost got a repeat of what's in your hand. Now they talk about, I'm going to flip to the next. Okay, so they have the appendicular skeleton, and we've already kind of chatted about that. It allows you to move, it allows you to walk, it allows you to do everything, right? It's your movement. It includes your limbs, and it includes supportive girdles, and we'll talk a little bit more about that in a minute. Are you guys okay with that? Alex, can you see what we're doing? I think Alex has got his mic.
Oh yeah, I can see just fine. The sound's a bit choppy, but that's it.
Oh, thank you. Is that just the feed is not so good? Yes. Okay, done? Good. So the pectoral girdle, and what they're talking about here is, look at my skeleton, is this area up in here. So this is the pectoral girdle here. And when I talk about girdles, that just means a circle, right? It just surrounds and supports. So it says it's connected to the body, the arms to the body, and it positions the shoulders, and it provides a base for the arm movement. And that makes perfect sense. When you look at the skeleton, I mean, if your arms are moving, it's all connected up here into that shoulder girdle, or pectoral girdle. The pectoral comes from the pectoris muscles, right? That's what that name comes from. Good. So it gives you an explanation of what the pectoral girdle consists of. It's your two clavicles on each side here, the scapula, which are in the back, these little wing bones here, and there we go. And it connects to the exoskeleton at the manubrium at the top here in the sternum. That's the pectoral girdle. We're letting everybody write, okay, Alex? Yes, to do that. So the clavicles are called collarbones, and you guys have all, had friends or family that may have fallen and broken a collarbone. That's very, very common. It's not a very big bone. It's, not got a lot of strength to it, so that's why they're so easily broken. So it's a long S shape, and it is kind of, I can't tip our tipsy skeleton over, but it is an S shape here. There we go. And it's attached to the manubrium here. And it articulates with the scapula, meaning when they say articulates with the scapula, it hooks up into the back of the scapula right here. And the acromial end, meaning this is the acromial process. So that area right in here, so it hooks up into here. Oops. I'm probably doing something wrong again. There we go. Oops. Oh dear. I always do that. I'm bad at these things. Okay. All right, guys. there's the scapula, also called the shoulder blade. I've heard people call it wings and all sorts of different things. So it's one of those flat bones, right, that we learned about earlier. So they're broad, flat triangles. And my son, who had talked to you about his mountain bike accident, landed on his head when he came down, probably about 15 feet, we figured it out. And he ended up accordioning his spine, which means like an accordion. He fractured vertebrae in here, 3 vertebrae in here. He also fractured his scapula, which apparently, according to the orthopedic surgeon, is very, very hard to fracture. You have to have a very, very hard blow. And he'd only seen about 3 or 4 in his career, and he had been a surgeon for quite a while. So he must have had a terrific blow if it broke that. So upper limbs include, of course, your arms, your forearms. When they say arms, they're usually talking about your humerus here for some reason, and then the forearms is the all-on radius. Your wrists and your hands. So that's all that is. The humerus is also called the arm. Like I said, I don't know why they do that, because I think the whole thing is an arm. So the humerus here is called the arm. It's a long bone and it's very sturdy. And it's the second largest bone next to the femur. This side bone. And again, it articulates. Articulates just means move with the pectoral girdle. So it's held up here. Up here on me, right there. My skeleton. Okay. So the forearm consists of forearm, which is the lower part here, right? Consists of your ulna and your radius. So your wrist, next one, has 8 carpal bones. So that's those little guys in here, right? Teeny guys in there. 8 carpal bones. What you have to remember out of this is that the number of bones, whether they're proximal or distal, is interesting information, but it's not really something you have to memorize. Okay, and they allow the wrist to bend and twist. The metacarpals, which are the 5 long bones of the hand, and I think you can see these. Metacarpals are here. This area right in here. These guys right here. And they're numbered 1 to 5 from thumb to little finger. Now, this is important if you are explaining to anybody, a doctor or whatever, which injured part, right? If somebody comes in and they've lacerated their finger, you know, it's like, let's say, 1 or 2 or 3 or 4. It's not, when oftentimes I see a lot of times people say ring finger index, but we're supposed to be using the 1, 2, 3, 5. So they articulate, again, just meaning that they move with the proximal phalanges. Are you okay on that? Okay. I've never actually heard this word very often. The phalanges of the hand, the pollex is the thumb. His thumb is right here. The 2 phalanges, which are the proximal and the distal, which again, you know, what proximal and distal. So proximal is close to the body, distal is furthest away. And we're down to the pelvis. So the sacrum we talked about when we talked about the axial skeleton. The coccyx, which is that little teeny tailbone here, right there, and the ilium, pubis, and the ischium, which is only really important when you get into maternity. Because we talk a lot in maternity about ischial tuberosities, which are those. And when we do maternity, we measure between the two of them. See how wide the pelvis is to deliver the baby. Daniel's making funny faces at me. It's like, I'm never having kids. Yeah. Don't even talk about it. I'm just mortified.
Is that the part that starts apart?
Actually, what happens when you're pregnant, this little kind of ligament in here is what spreads. Nothing ever comes apart, but it just gets really soft with the hormones, and then it does move open. It does kind of open. So moms will get pain just, during the pregnancy, it'll get uncomfortable down there because everything's kind of stretching. But the bones don't come apart, but they are still attached. And we're going to talk about the difference between male and female anyway, so that's okay if we talk about it now. Okay, so we have L5, which is your lumbar 5, is attached there. Okay with this, guys? Now this one's really important. The reason it's really important, I've handed you out a injection site. Yeah. Hang on to that because you're going to need that for your nursing classes. What I've done with mine is I just took a felt pen and I colored in the areas that you give the injections. And I'll just find mine here. I can show it to you. Wherever I put it, there it is. Yeah. Oh, sorry. Did I get it up wrong? So Alex and the other people that are online, I will try to send this to you. And it's just a diagram of where to give injections. This is important. So, see where all those little dots are? Yeah, those little dots right here. The inside of that, that's where you give the injection. It's nice to have this because it actually talks about the bone. It talks about muscle that you're using. And the bones and the muscles are, you will have to know. So this is a good one to hang on to. Okay, so what you're trying to avoid when you're giving an injection, right, is the sciatic nerve. So the sciatic nerve, no, I can't put this guy up to show Alex, but anyway, the sciatic nerve comes out here, and it runs across the back, and then goes down the leg. Now, if you were to do an injection here in the center of the buttocks, you would end up hitting the sciatic nerve. And that can cause severe pain and can cause nerve damage. And there have been nurses that have been sued doing that. So be very careful when you learn how to give them that you're not even getting close to that. And this is going to be stressed over and over again. This is one of the liability issues as well. And it can do a lot of damage. So you're giving it up here. Sort of up here in the ilium. You're not even close down here. Okay. Tipsy's, he's behaving today. I kind of readjusted him. I said I gave him a little bit of chiropractic. So he adjusted his bones. Right. So the word that you're going to be hearing over and over again is this one up here. Ventral gluteum. That's one of the muscles that you're going to have to remember the name of. And we're going to go through that again when we get onto the muscle tissue. So no, don't worry about that too much. Now, we talked about the female and male pelvis, remember? We just talked about those tuberosities. The difference between the male and female is the shape. The male pelvis is shaped like an oval, more like an egg shape. It's thin at the bottom here and thinner in here. And there's less space between these two ischial tuberosities. Now, you don't have to panic about this. This is more for maternity, right? But I'm just giving you this information. The female is what they call a gynecoid, which means gynecology, gynecoid pelvis. And it's much rounder, allows a lot more room for the baby to go through. And these tuberosities are apart. So there's a difference between male and female. And this could be, have a look at. We'll have a look at Tipsy. I would say he's a male because it's quite narrow at the bottom. There's not a lot of space there for babies, right? Maybe we should call it Tipper then, not Tipsy. Tipper. Good, I like that. Okay, so lower limbs are your thighs and lower legs. And the function, we talked about those huge femurs here. They're of course going to bear a lot of weight. They're going to take most of the weight of your body. And they're of course for motion, to walk and to move. So the bones of the lower limbs are the femur, the patella, the tibia, fibula, the tarsus, metatarsus, and phalanges. Now we've gone through those already, but I don't know if you guys just want to write them down. These, like I said, these you'll have to know those names, right? You'll see those all throughout your nursing training for sure. The femur is the longest and heaviest, and we've also chatted about that already. The neck up here, this part in here, the neck in here is most of the time, if you have an elder person that falls, that's where it fractures. It fractures through here, and it breaks off the ball of the socket joint and this area in here. And oftentimes, when you get a patient back, you will have information from the surgeon, or it'll say it's been pinned. They'll tell you that they actually ran a pin right through here, like that, to hold the two bones together. Or it's been plated, depending what type of surgery they choose. Yeah. You'll see, I'll just lift this up a little bit, right? It's those internal fixation, which is an IF, meaning that they surgically put a pin or a plate in there. So you may see that on your chart, IF, internal fixation.
Could it apply to any extra body part that we've added, like either head or anything like that?
Yeah, it could. Because I mean, if you fracture, say this tiny bone here, if they put a pin in it, some people do have head pins, they just won't heal. It'll be internal fixation. Yeah, there's a lot of people that break their scaphoids. I'm really surprised. And that scaphoid is just this little tiny bone right here. That's that little guy right there. And it's causing no end of trouble for one of my patients in Ashcroft. And it's causing no end of trouble for a friend of Nathan's. Because when he fractured that scaphoid, he actually damaged the blood supply. Yeah. So now the bone isn't healing. It's not the blood supply. So
she has a hard time using it now.
Yeah.
And she has a hard time getting it. We've done a car accident and she hit it somehow.
Right.
Like snap.
Oh goodness, that's not good at all.
No. It was funny because she's like, "Oh, nothing's wrong with me. I'm fine." I'm like, "Your hand is not
Yeah, it's not working.
It was like huge. I'm like,
Yeah.
oh my God, I guess I'm not fine. Not the greatest. Yeah.
So of course, this other, you have that long, nice, large, thick shaft, and then this, of course, is part of the knee joint. So that ends up being a knee joint.
Do you have to know all that stuff?
The femoral head, for sure, because that's where the fractures occur. The greater trochanter, you need to know that word too. Because when you, what they call landmark for your injections, you will be reaching around and you'll be feeling for this greater, and a person's laying down on a bed, you'll be feeling for this greater trochanter so that you can landmark that you're giving your injection here rather than way back here. So that word is important. Okay. Now, talking about the kneecap, the patella, which is the kneecap, which sits on top of the knee right here. And remember, it's a sesamoid bone. We talked about sesamoid bones when we did osseous. I always think of sesame seed bones, and I don't know why. It's kind of shaped like a sesame seed, so that's a good way to remember it. It's a sesamoid bone. And it is a protective bone, so it protects any sort of trauma that's coming in this way and hits the patella, and it's protecting the whole joint. So it has a job. The tibia, called the shin bone by some people, that's the big one. And it supports a good portion of the body weight. It's larger than your little side bone, which is the fibula. Talked about that too, this little side guy, that's the fibula. So it's medial to the fibula. Well, that's easy to figure out. It's right there on this side. And lateral. So lateral is your outside, right? So it's lateral. And you're going to hear all these words when you start your nursing courses. And supports the body's weight. I'm getting hungry. Not even close. I should have eaten that. Anyway, so the ankle bone is the next, called the tarsus. Again, we're down with the T's for toes. So tarsus, and it consists of 7 tarsal bones. Feet are the phalanges, which are bones of the toes. The hallux is this bone right in here. The reason that they kind of put this on here is because a few people fracture that bone, but also you'll get people who have, especially your elder people, have what they call hallux valgus, which is where they have bump out here at the side of the foot, and it's quite a large bump. And what's happened over the years, the tendons have shortened on the inside of the foot, like on the plantar part on the bottom of the foot. They've shortened, and they've actually pulled these bones, pulled the toe inward, and pulled this bone outward, and you get this big lump here. And why that happened? My girlfriend, she's yes, yeah. It can be from use and abuse, like a lot of walking. It can be from shoes that are too tight, which pull the toes inwards, like your nice pointy shoes. So podiatrists don't like people to wear pointy shoes for that reason, because pull the toes inwards, and you end up with that. They can be very painful, and they will repair them, but they usually put in a rod to keep them straight. And so just having them repaired is a big deal. So I won't get mine repaired. So, anyway. Okay. Here's that little clicker.
So articulations are our next subject. So articulations are your joints, which is simple. And they occur at the void, where the body moves at where the two bones connect. Not too exciting. So the joint structure itself determines the direction and distance of movement and range of motion. Now, range of motion, you're going to hear a lot in your nursing career, and I'm sure you've already taken that in your HTCA program, right? So range of motion is something that you would do with a patient to make sure that their joints don't stiffen up and they're still useful. The interesting part about knowing about range of motion for nurses is we have to know which joint does what, so we don't overstress the joint by trying to make it move inappropriately. Maybe that joint doesn't move that way, and we try to bend it that way. So the joint strength decreases, and that's important, as the mobility increases. So make sure you make a note about that. And it makes sense. The more you can do with the joint, the more it loses its strength. In a way that if you have your tiny finger joints, like they can do so much more. They can grasp and they can move and they can do all sorts of wonderful things. But they just don't have the strength that, say, your elbow joint would have. This is a big joint. It has lots of muscular tissue in it. Or your shoulder joint. Let's talk about where bones are not fused, locations where bones are not fused are weaker. Well, our fused bones up here are in the cranium, right? They're fused. And if they're not moving, of course, they're going to be a lot stronger. That makes sense. That's just logical. Okay. So the major categories of joints and the structure and function of each category. We're going to do that. So these ones I want you to pay attention to, because these ones you will have to see again. So the SYN, arthrosis, they're just prefixes, right? Means no movement. So arthrosis is your movement, your bones, your joints. Amphiarthrosis is little movement. And the diarthrosis is the most movement. So your diarthrosis would be your elbow joints, your knee joints, your shoulder joints, your hip joints. Those are the ones that move the most. Sorry? One back? Yeah. Okay. No, that's fine. No problems. Okay. You have time, is there? Okay, synarthrosis is immovable, not moving joints. So we already described one of them, and that's the bones of the cranium. They've been fused together, and they're not moving at all. They're very strong, and the reason your skull it's protecting probably the most important organ in your whole body, is your brain. So therefore, it has this huge protective cover that doesn't move, so it's very, very strong. And the bone edges interlock, and we talked about the suture lines, so you know that that's the interlocking
part is the suture line. Amphiarthrosis is slightly movable. So that would be joints between your ribs and your sternum, because every time you take a breath, those are moving a little bit. They're not moving a lot, but they are moving a bit. So they are slightly movable. Okay. Now diarthrosis, now this is where we get into a lot more information because they are freely movable joints. They're called synovial joints. And the reason they're called synovial joints, we're going to discuss in the next few PowerPoints. But synovial is the synovial fluid. It makes them move freely. Now they're divided into 3 different categories, which is monaxial, biaxial, and triaxial. Try not to get confused with the axial word. Axial just kind of means the center, and that's why the axial skeleton is the center. So monoaxial would be moving in one direction, biaxial is 2 directions, and triaxial is 3 directions. So I'm trying to think of a monoaxial, let me think of a good one. Probably your finger joint, because really it goes up and down. It doesn't go in circles. Biaxial is more like a joint here with your ulnar radius, because you actually can go up and down, and you can turn it as well. So it's more like a biaxial. And triaxial would be more like a shoulder joint, where you can go up, down, and you can do a circular motion with it. So that would be more like a triaxial joint. So joints can be bony, fibrous, or cartilaginous, or synovial. I'll just go through that one because we're going to be discussing those ones. I'm going to go back so you can I thought there was more information about that. Okay, so the structural classifications are bony, fibrous, and cartilaginous. You might want to write that down. Nice. So next, what was the last one? Sorry, synovial. Okay. Okay, so they really are, like I said, they focus a lot on synovial joints. So we're just going to talk about the synovial joint itself. So they're the movable joints, and they're at the end of the long bones, right? So each one of these joints, the top of the humerus, this joint in here with the radius and ulna, top of the femur, knee, all those are at the ends of the long bones. They're within articular capsules, and we saw a picture of that earlier when we were looking at patella, where there's a little, it's like a little balloon around these joints, and because they need to contain fluid. So there's like a little balloon. So they're lined with synovial membrane, and they contain synovial fluid.
So it makes perfect sense for these type of bones to have that type of structure because they need to be lubricated and they need to move smoothly. Good. Articular cartilages are just, again, articulating movement, right? So the padded surfaces within prevent the bones from touching. The smooth surfaces are lubricated by synovial fluid, which reduces friction. So if I was to ask you a question on an exam, it would say, what is the purpose of synovial fluid? What would your answer be to me? Yeah, reduce friction. You're right. Lubricates. Good. With age, yeah, the bones start to deteriorate and the fluid. So the synovial joints, they talk about accessory structures. So they're talking about now the cartilages, articular cartilage, which is a cushion, cushions the joint, and the fat pads that also help cushion, ligaments. Now, I have a problem myself getting ligaments and tendons mixed up, and I don't know why. But I've learned tendons are the pulleys. Like I have really easy to see tendons in my hands. So tendons are the pulleys, and ligaments are the wrappers. They wrap around the joints, right? So the ligaments support, so they're the wrappers. And the tendons are the pulleys that pull the muscles that are attached to the muscle. The bursa, you'll hear lots of people who have bursitis, right? I haven't had it, and there's lots of people who do. So the bursa itself is within this capsule as well. And you'll oftentimes hear of bursitis, and it's usually from overwork, and you just stressed it and inflamed it. What the bursitis is. Are you good? Dislocation or luxation. We see a lot of dislocations. I don't know why, but it just seems that so many people get injured, and that's what they do. They dislocate their joints. So a dislocation would be if this shoulder joint comes out of the joint and is pulled upwards and sits up here. And it's very obvious when you have somebody coming into the emergency department. It's very painful, and they will be, hunched over down the hallway, looking like they're in severe pain. And there's a visible lump there where this bone has been pulled up because the shoulder girdle muscles are strong, and they actually, if it comes out of its socket, they pull upwards, and so it's a big lump at the front of their body. So that's easy to diagnose, I should say. So it damages the articular cartilages, it damages the ligaments and the joint capsule. So dislocations are bad because once they've been damaged, oftentimes the dislocation will come out again because the muscles are weak, the ligaments are torn. So a person may have the one dislocation and then have to come back in several times because they keep dislocating it. Subluxation, which is just, it's pulled forward, right? It hasn't been pulled completely out of the socket, but it's partially out. So when we have dislocations come in or subluxation, we usually have to put them back into the socket. The danger with these is because the muscle has pulled the bone up and is kind of crushing all the tissues because the muscle is tight,
Oftentimes you can get some nerve damage with these or circulatory damage. So you have to be very, very careful that you're doing your color, warmth, sensation, and movement and your cap refill when you have people like this come in. That they could have circulatory damage or nerve damage. Numbness and tingling isn't something you want to hear somebody say when they've dislocated something. If they tell you that their hand or their foot or their leg is numb and tingling, you have to worry that the nerve has been impinged and damaged. And some of the damages can be permanent, so you have to be careful to get that back in as soon as you can. So planes are axes of dynamic motion. So your axial, we talked about axial, right? The word is the center line, the center. So the mono are ankle, knee, elbow, fingers, toes, up and down, up and down. Also between cervical 1 and 2, it's side to side. Cervical 1 and 2 are up here, your cervical. Here, you can go side to side. The biaxial is the wrist joint, up, down, backwards, and forwards. Up, down, backwards, and forwards. Anyway, and the triaxial, like I said, is the ball and socket one, the hip and shoulder, that they can actually do a full rotation as well as up and down. You need some more of that? Good? So linear motion, dynamic motion, linear motion, it's got page 225 there in your textbook, is a gliding motion. And that motion you'll get between your bones in your hand. So that's a gliding motion. Angular motion, flexion, extension, abduction, adduction, and circumduction. Now those ones you will see many, many times in your nursing career. Abducted fractured hips, right? They're laying outwards. So we're going to talk more about that as we go along, but those ones are quite important. Rotation is easy, left, right, and that's these ones that can do everything. Your shoulder joints, your hip joints. Let everybody write them down. Good. Pretty good, right? Yeah. Okay, so they talk about the linear gliding again. They're talking about the hands, torso, and the carpal. Between the clavicle and the sternum, these ones right up here. These guys right here. Okay. Now flexion is easy. Front, backwards, forwards. That's quite easy to understand. You will have injuries from this hyperflexion. So if the hyper is too far, and hyperextension, hyperextension, hypoextension, but the hyperflexion is your neck injuries and car accidents, right? The whiplash. So that can cause some injuries. Abduction and adduction. Now these ones I have problems. Ab is away from. So your prefix ab means you are moving away from the center, moving away. So if you have a patient who's broken their hip and that hip is broken, pulled upwards and abducted, meaning that the foot is pointing away from the body. And adducted is into the body, into the midline. course, circumduction is the complete rotation. Shoulders and hips can do that. Rotation, you get a rotation in your ulna and radius, so you can turn it this way. If you have somebody come in and you're not sure, or they're not sure if they've broken their arm, but they're complaining that they think they might have broken their arm, one good way to tell is to get them to rotate. Because if they can't rotate, they probably have broken it. They can still go up and down with it, but they can't rotate. And usually it is the smaller bone on the side of the ulna that's broken if they can't rotate. Inversion and eversion. So you can, easily explained on there. So it's turning the foot in and out. Dorsiflexion is important with your elders because oftentimes they will have foot drop, which is the plantar flexion, right? The foot goes down because of weight on the covers on their feet, or that they've had a stroke and they just don't have the proper innervation to their foot. But you may get plantar flexion, the foot laying down like that, if they've had some damage, or if you are really a nice nurse and you decide to put all sorts of covers on their feet. Cushion them. Opposition is just a finger movement, so that we have opposable thumbs. We can bring them in. I'm trying to remember, monkeys have opposable thumbs too, don't they? I can't remember if they do or don't. I was thinking about the other day, the difference between humans and monkeys is I think humans have opposable and they don't. I'll have to look into that. I'll go in the net. I just can't remember which way it is. Alex probably. You can just tell us. Okay. Protraction and retraction. So that's just moving the planes, right? So protraction goes forward and retraction goes back. You would get problems if the person has issues with their joint right here, in the mandible, maxillary joint. Elevation depression is opening and closing your mouth. So open and depression, quite easy. Lateral flexion, which sometimes I don't have very well because I've got some really tight neck muscle. So they're talking about the movements of the vertebral column now. And flexion extension, so it bends anteriorly, which bends forward and backwards and lateral, both ways. Right. Rotation this way, right? Your circle. So your vertebral column can do all those things. So effective aging on articulations, and that's something we were talking about just a little while ago. Danielle had mentioned that a lot of the patients, you can tell they're not moving as well, they're in pain when they're moving, and the reasons are, well, rheumatism, talk about several pathological conditions of the muscles and tendons, and it's characterized by discomfort and disability, and arthritis is actually damage to the joint itself. So most of this rheumatism is in the muscles, tendons, and joints, bones and nerves. So the whole, and then the arthritis mostly is cartilage damage to the synovial joints. So that's the difference there. But you have patients who say, my rheumatism is acting up with the weather changes, which could easily be true because maybe it is involved with the muscles. The muscles are sore and tender, so that easily could be true. But your patients with arthritis, there's two different kinds, and we're going to look at the two different kinds. Yeah. Osteoarthritis is what they call the wear and tear arthritis, right? So over the years, they've been walking. You'll get a lot of men who have been working on heavy machinery who have osteoarthritis. It's just the constant banging and damage of that. And the other people who get this are joggers. People who decide that jogging is very healthy for you, yes, but they're jogging on hard surfaces. They're jogging on concrete or on pavement. And the constant banging of the pavement, you know, causes damage to the joints. So they will get osteoarthritis. You can see with the picture, it's the cartilage is eroded, there's bone spurs, and the meniscus too is eroded as well. And sometimes it's both bone. So those are the people you'll have getting joint replacements. My dad had both of his done. He was a heavy machine operator. He used to drive a cat, and he ended up having both of his knees done for that. So that's usually caused.
Do you have a lot of pain in his knees?
Pardon me?
Do you have a lot of pain?
Yeah, a lot of pain and stiffness, and they weren't functional. Like he couldn't bend down; they just wouldn't support his weight. But after he had the knee replacements done, it was perfect. No pain. He was able to do a lot more. He was very active after that, and he was really sad. He said, "I don't know why I waited so long. He suffered for so long." He felt so good when he got them done. So I'm a real proponent of somebody getting their knees done if they need to. It's great. So rheumatoid arthritis is more of, it's not a wear and tear, it's more of a disease process, right? It involves the autoimmune system. So it's almost like a rejection of the tissue. It's like an allergy. The body rejects those tissues. It causes pain, swelling, and thickening. And then you'll see lots of disfigurement almost. The joints bend. A lot of people who have rheumatoid arthritis have hands that are bent inwards like that. You know, they bend outwards, or they bend inwards. It's really quite sad. It's quite common. It's very familial. Like if your grandma has it, you may have it or something like that. So it does run in families. It's not genetically. It's genetically passed on, so you can see it in the families. Gouty arthritis. Well, gout you've heard lots about. I'm sure there's lots of people that have had gout or relatives that have had gout. It is usually in the great toe, like the first joint here in the great toe. Hallux. And it is caused from uric acid crystals that build up in that synovial fluid. And then they're crystals, so they're hard little pieces, and they grate on that joint, cause inflammation. You'll see it often it's a metabolic disorder. They say purine foods. Purine foods, we have a lot of it in the Okanagan because so many people eat fresh fruit down there. And we'll get a lot of people who have gout during the fruit season. So, or red wines are bad too. So the mass of the bone decreases. Well, we've already talked about osteopenia, which is the decretion, and then osteoporosis, which has the holes, right? So that mass decreases and it becomes weak because you don't have that nice matrix supporting the bone anymore. And then, of course, the thing that we all hate to see is hip fractures, hip dislocation, that type of thing. So when do you think women should start taking calcium supplements? What age? In the 30s. Actually, way earlier than that, in their 30s. Yeah, they should start taking calcium. Because unfortunately, women are more prone to osteoporosis than men are, and it's because of our hormones, our estrogens and progesterones. They weaken our system, and as you age, they drop, and you lose more of your bone structure. So yeah, you should start taking some supplements early, and you won't suffer.
Yeah.
Pardon?
I haven't been taking them.
No.
No.
Better start. Yeah, you better start. I think it's 12. Yeah, it's 1,200 milligrams per day.
Yeah.
Up to 1,500 milligrams if there is issue, if we have problems. Yeah, so it's
Two monometers are lactose intolerant, and it's harder for us to
Right.
It doesn't stay, it goes right through, right?
So actually, I'm lactose intolerant. I'm actually allergic to milk products.
Yeah.
So I just substitute other products that have more calcium in them.
Yeah.
Like Danielle's broccoli. That was cool when she said that actually. Like, oh, I didn't know anybody knew about broccoli. Never saw broccoli. Yeah, so those type of things, you have to substitute something. My son is allergic to milk when he was born, so all through his life, I've been substituting different things to bring his calcium levels up. Mm-hmm. Yeah.
Especially when you're really low.
Yeah. Calcium, when we start going into bone structure and not bone, like bone and muscle, into the muscle, calcium is used a lot. So it's very, very important. Okay, so bone recycling, and we've done this before, right? The osteoblast and the osteoclast. So we've really already covered that. So the bones of elder people don't recycle as easy. And I know we studied before that activity, walking, doing any sort of exercises speeds up the bone matrix, like it speeds it up. It makes it work better. So if these people are sitting around resting and not walking and not exercising, of course they're going to lose more of their bone mass. Talked about hormone levels in women for sure. You have to be careful with that because we are going to suffer mostly from osteoporosis. Oh, men do too, but we're more prone to it. And your kidneys. If your kidneys are not functioning as well as they should with age, calcium and phosphorus uptake and excretion is going to be unbalanced. You're not going to have that homeostasis that you used to have. Genetically and environmental factors. Genetic would be as my mother and father were fine. I didn't have any osteoporosis in our family, so I'm hoping we don't. But you'll see that there is familial predisposition for these types of things. Okay, so we're on to the shoulder now. Just watching the time. I'm not sure how much more we've got, but we'll work till 2 o'clock and then we'll have our break. So the shoulder bone joint allows a lot more motion. It can rotate. So that's, and it is a ball and socket joint, right? So we already know it's supported by the girdle here that supports the body. We've already covered that. And it says it's the least stable. So because it does so many movements, because we talk about the more movement it does, the more unstable the joint is. So it's the least stable in the body. And I can attest to that because I've had lots of shoulder injuries in my nursing career. Because we tend to always be pulling, pushing, lifting, and our shoulders are really at risk. And that's kind of why I gave you that lifting thing, because I don't want any of you to get hurt. The elbow joint. Now these muscles here, you're going to have to know, I'm just going to bring them to your attention now because I don't want to forget later. So the biceps muscle is this big one here. Lifts your arm, inside one. And the triceps muscle on the back is the one that brings it back down. So you can see where the tendons come down and they're attached to the ulna and radius down here. So the muscle actually comes down and then it's attached lower down here. Then you have your ligaments that are also in here to protect that joint. And there's your bursa right here. And we talked about bursitis. Bursa's on there. And you'll get people with tennis elbow, and that is a bursitis. Okay, questions? Good. Whoops. It just did its own thing. Okay, the elbow joint is a stable hinge joint. When I talk about a hinge, it's easy to see that a door hinge like this is just like an elbow. It only goes one way, right? So it's a hinge joint. So it has articulations between the humerus and the articulations are just the movement, right? Between the humerus, the radius, and ulna. And it talks about this movement, twisting movement that we talked about. when I was talking about broken bones. Did you get it out? Yeah. Okay. Hip joint, also called coxal joint, which is something you don't really have to know because I don't think I've ever heard that word. So it's a strong bone socket diarthrosis with a huge range of motion. You can turn it, you can twist it. And it's actually, I'm surprised that this isn't the weaker joint, but I guess the shoulder joint is the weaker. It's unfortunate that they don't show you a nice ball and socket in here. They put the muscle tissue over there. But then again, the greater trochanter is there, and the muscles are attached here. So you can see the type of damage that would happen if an elder person fractured this part of their femur, the neck here, they fractured that. Then all these muscles are going to shorten up and they're going to pull that joint upwards. And a lot of these muscles probably will tear. So when they put this back together, there's going to be a lot of healing that's going to happen. And I try to, with my students that I have in Penticton Hospital, acute care clinical, is I try very hard to get them into the OR for a hip replacement or hip surgery, so they can just see how stressful it is on the person. Because when they come out, they certainly have a good understanding of why that person's in pain. They actually take, when they do the hip surgery, we're talking about some elder, frail little baby, and they take the hip right up here and the leg up here to do the work. So you can imagine how painful and how much it's going to stretch all those muscles. I'm sure she hasn't been doing high kicks for quite some time. So it's really very painful for them. Okay. Knee joint, a complicated hinge joint. I don't know, complicated, that's okay. I think because there's the 3 bones instead of just the 2. So the quadriceps muscle that they listed on here is something that you're going to have. That's it. Yay! It's 2 o'clock. We can have a break. Okay, Alex, we're going for a break. So at 20 minutes after 2, we'll start again. Okay. Perfect. Yeah.
Now you got me. I wonder why I've been texting this whole time. I don't know.
Total stranger. You're probably,
Who the hell is this person and why am I thinking, what the hell? You're like, I wonder if the other people have been texting the wrong number too. I don't know if it was yesterday or today that was National Health. Yeah.
was it? Oh, they actually have a special day for you guys. Awesome. That's pretty nice.
Just found me.
So did your boss give you flowers or something? No. It's really funny. They had, well, it's not funny, but they had a staff appreciation day in Ashcroft a few years ago. And they had a barbecue and they actually had people at the bakery cater it, right? So they brought up, nice stuff and like it's salads and stuff like that. Well, afterwards, a good portion of the staff got normal. And that's what you call appreciation for staff. I know. They were really sick. And I was there and I didn't eat the salad because being diabetic, it was like a noodle salad and I couldn't eat the noodles. So I decided I wouldn't have it. And I was one of the few people who didn't get sick. Anybody who ate the salad, I can't remember, it's some kind of noodle thing. Anyone who ate that got normal and they got really ill. And so the public health department tracked it back to the bakery, and the lady that had made the salad was ill at the time that she made the salad, and obviously didn't wash her hands properly or whatever. Yeah. So much for staff appreciation. They made them all sick. It is. Well, my girlfriend calls it nor run. Why do they call it walk? Because you're not walking anywhere. Yeah. Anyways, I'm gonna go have my lunch and change.
That's so awesome. Really? Yeah. But like 2 more months. 3 more months to go for the baby.
So I shouldn't make faces. You talk about flavor.
Like they say, probably like when in a group of, there was a group of 10 of us when we were doing their I don't know, the exercises and stuff for breathing and stuff. They said out of the 10 of us, probably only 3 of us would only give birth naturally, the rest of us would have surgeries. And that was exactly how it happened. Like I had a C-section, and probably the rest of them did. There were only 3 of them out of the whole class that actually had to be natural.
They kind of promote C-sections nowadays.
I was pissed when my husband was like, he goes, oh, you went through the easy way. And I was like, are you fucking kidding me? I was so worse. And I said, how will you try getting your stomach cut open and walking around the staples and having to have you lose your whole self-esteem because you can't go to the bathroom by yourself? Like, you need somebody else to go to the bathroom with you so you can go to the bathroom. And you can't laugh, you can't do any of those things. So, I mean, my time was terrible. Like, I was going to the bathroom, right? I was like, going really slow. My mom was coming in there to help me go to the bathroom. And then, I can laugh about it now, but at the time, because they give you those cotton underwear, the mesh ones, and they got stuck on the bottom of the toilet seat. And she was trying to pull it up, and it was like clanking on the toilet, and she starts laughing. And I just let her laughing. When you start laughing, you have too much muscles under there to eat. Then you can pop a staple out. So then I felt the pain. I'm like, get out right now, because I was in so much pain. And here she was laughing, right? It was like, I knew it was funny, but it was like, I'm in so much pain. Get out. And she's like, no, don't be. Get out. It's like your first. That's so exciting. I was teasing your friends. Like, oh, when's the next baby coming in? Like, they're going January. I'm like, what? No, right? Because I was teasing them, like, we have more babies, and he's so cute. Because I haven't talked to her for a long time. And I said, oh, that's so awesome. I'm so happy. That's cool. When you're lucky. I'm the boy. Really? Yeah. That's awesome. Did you guys pick their names? No, not yet. No. So you'll be here possibly or not possibly when we have our baby? You should be still here, right? I'll be back. Yeah. So we're going to be present. I was dreaming about babies last night. If they don't have anymore, like I feel we have one. So when I see people with babies now, I feel like I appreciate the fact that my health would stop it, so I just have one. So it's like, so when I see all my nieces, my nephews, I'm like, just walking this way. So bad. Like I see one of my nieces at the theater last night. come running out. She's all happy to think they're going to get her thing. And she loves candy, and we didn't eat her candy, but the girls started. So I'm sure you love candy. She's like, yeah. Her mom's like, no, no. She's only like 2 years old.
Are you lactose intolerant? It's funny that you say that, because about like 70% of my hallucinations are kids.
I noticed that too. Like for me, if I have ice cream or anything like this, I'll go right. Any milk products, like ice cream and those things, just seems to like rip right into my body. Probably because all chemical like first patients didn't have that access to milk, right? Like when you look way back, the milk wasn't a part of, they got it elsewhere. And maybe the cookies and everything wasn't there. And then the milk didn't come in until like the thousands and like then it started coming in, right? And then the sugars, and then that's when all the changes like diabetic and all this stuff started coming in the first patients. They didn't have sugars before, they didn't have all these things, and all of a sudden it was introduced. And then their whole body was changed and went back. Well, I did First Nations politics, and I was like, what the hell? See all this stuff changing. How healthy they were before, and now like the health of First Nations is so bad.
Well, it would,
The diabetics too are really bad with First Nations.
it would be really interesting to find out about the diet before, so that.
I have a paper that has a diet. I have a book.
Is that right?
Diet, yeah.
Oh, great. Oh, please, I'd like to see that. I really would. Because, like I say, my eldest boy is severely allergic to milk products. I'm allergic to milk products, so I've just substituted over these years. But yeah, you're right. There's people out there that just can't cope with milk. And I know that I've had lots of different doctors say that adults really don't need milk. And children, breast milk is best, of course. You've heard that a million times. And then to go from breast milk just into solid foods and not have cow's milk at all. And there was a study done in the Netherlands about cow's milk and diabetes. And it was really interesting for me to see that, because it said in the study that babies that are introduced to cow's milk before their 9th month may develop diabetes later on in life, because the antibodies in the body don't identify the difference between the cow's milk antibody and the pancreas. They can't tell the difference because the body's just too young, it's not mature enough to figure it out yet. So they were finding that there's a very high incidence of juvenile diabetes in the Netherlands and Holland and in that area. And that's why they came back to the fact that milk was introduced right away before the 9th month. And that's why they felt that they were having a lot more people with diabetes. So, yeah, unfortunately, that my eldest boy, I have diabetes. So, unfortunately, my eldest boy never ever had milk products at all. So, he wouldn't have been sort of predestined to have diabetes. So, you're right with the Aboriginal diet. I can't imagine that they had cow's milk product. They would have breastfed their babies, and then they would have gone on to whatever foods that they had. Solid foods.
Because she was lactose intolerant really bad, and she didn't have it. And as a baby, because she couldn't have the calcium and stuff that her siblings had, and because she wasn't taking to the breast milk, they had like helped her survive on chicken and soup and tea.
Yeah.
Like that's the only way they could keep her alive physically. Because back then, you know, to come to town, you had to have a horse and buggy to come to town.
Yeah.
You know, and even then, the cost of things then was expensive to have, you know, by formula and whatnot. So for her, it was they did what they had to do. You know, she survived, but she's like really like it's.
They're fragile.
Very fragile.
Yeah.
She loses easy.
Did she have when she stands, are her bones curved in her legs, or does she stand straight? Yeah, she's pretty straight. So she did somewhere along the line get enough calcium. Vitamin D. But it would be really, really interesting to see what the Aboriginal diet was, because I think I can learn a lot from that for myself and for my son, who
we don't use any milk products.
They have a book on it. They actually made it, I think, 2 years ago.
That would be really nice to see that. Actually, I'd like to, hopefully, I don't know if I'm going to be, I mean, I'm teaching this course, but I don't know what else they will ask me to teach or whatever.
Yeah.
I would really like to get into Aboriginal herbs and medicine, things up there too.
That would awesome. All of that stuff.
Oh, is that right?
Yeah, I did a presentation, I think, last year. I think it was for my program. I did a presentation. And it was all like First Nations, like foods and medicines and herb stuff, like to help you.
I know my girlfriend Jackie, she's living with us, she's married. Whatever. Anyways, he's First Nation, and I have problems with my kidneys because of the diabetes. He was telling me that he's interested in Aboriginal medicine. He's not a shaman, but he told me that asparagus is really good for cleaning the kidneys, keeping them healthy. So I'd really like, for myself, I'd like to have that information so I can help myself. So that'd be good. I hope you can find the book.
See, for me, I don't like to do a lot of our stuff. I don't know the name for them. I know only the First Nations name for them.
Right.
So, like when people say a certain thing, I'm like, I know what that is. Like,
Right.
I don't know what language is, because that's the way I'm taught.
So in the book that you have, is there like drawings? Like, oh, great. So
Yeah,
it's
there's
saying,
English in it.
oh, great. Because I was thinking like asparagus or something maybe had a name or
No,
whatever.
they have a name, I just don't.
It's not an English.
Yeah, yeah, and like, I know where they grow, but I've never, my grandparents, because it was too far.
Yeah.
You never went and
You know, they were using soap berries for one of our
so
patients.
cherries is good for a lot of things, like flushing your body out.
They were using, well, one of the patients had them people bring it in for her. We tasted it, like the nurses tasted it. That was horrible.
It's very bitter, but
It's like,
it does
yeah.
a lot of fun. I guess it's like how they say they have those where they collected.
Yeah, right. Yeah,
Internally.
they do that in the health
stores.
stores.
For like every body, or to install your insect cleanses it right out.
Oh, I'm gonna go in and get some food. Peter's got it.
Feel it.
Okay.
Some cheese and crackers?
Quick. Okay, so eat fast.
My brother, he's got 2 daughters. He said, girl, she's now, she's on the hospital. She loves them, and like, he's one of the one that has the same liver, and it was like, he wants to come with my grandma's got that, she was saying, what is like, and then like, favorite person to the end of it. But I'm prepared, I know that it's gonna happen, because you know these things, you know what's coming. And I look at my brother and I see his face, and he's kind of yellow now. And you can see it's coming, and I like try to prepare my daughter. He's not healthy, and he won't stop drinking, because that was his way that, in some ways, where they say the residential school effect, it had affected him more, right? Because of the abuse and all the stuff that he had. And back then, it was the boys who got the abuse, so that they were stronger in their minds and their ability. So even though you're stronger, you can stand up for yourself. And the girls were more like, some of them, I mean, I wasn't one of them, but my brother had that issue of the grandparents. There was that abuse for him. So now he has become an alcoholic because I was discovered. And even when he did try, he like that was the longest for him. And now it's like the river he can't go without it. And there's no water, every one. It's like everywhere. It almost looks like he has measles because it's just big red spots all over his face if he doesn't have.
I think they say that putting alcohol is harder than putting like that.
Yeah. And it's just watching him, you know, like he knows what's going on with his body, but it's like, in him, he doesn't know how to hold it, that he hasn't like, allowed himself to be loved, and he feels that he deserves to be loved here. And nobody can fix that unless he's ready to change this kind of thing.
My ex-boyfriend, he's from Toronto. And he's like, I wish that they would have like First Nations like educations for people when they come to our town.
Yeah.
Because you'd be like, oh, they're just drunk on the corner. And you'd be like, do you know like they're alcoholics? Like, do you understand? No, we were maybe should try and understand what they got through. And he's like, you never see white people outside drinking. Yeah, because the fucking government will pay for them to have a house and stuff. So of course you don't see that. Like, the government consists of people out on reservation that are like half an hour, 45 minutes out of town. Mm-hmm. What the hell do you expect? Like, oh my god. I was thinking it's kind of rich. Oh my god. He was a real treat. Mm-hmm. And just, you know, like you came to protect people and support them.
That was a good mentality they had, right? It was like, that was the biggest thing I did when I do these. I brought in like with like instructors because their assumption is like they have that assumption. And it was like, you know what, you need to sit down and they don't think that I can know this because it's like I come right from that lifestyle. And it's like to survive the reserve, to survive coming out of the reserve is a lot. Just come to where you're at and to be strong enough to come out of it where it's not a lot of people are not.
And I think too, like, in oh, great, I'm not so bad about it. And, like,
Yeah.
people can be a little bit in reserve, but we just don't understand.
Yeah. I mean, I have more than I can see like 45 years from my house. I didn't even the quality of my community building is shitty. Like, you can hear everything outside the door. Like, it's going to be outside. You can hear it, like, beating down your house, particularly. And then you go into a house like downtown and they have, like, even if the window door, you can't hear it. Mm-hmm. So the quality that they put in their house I'm paying. My mortgage might end up paying like $250,000 for my house. It's nowhere near $250,000 house. But then that's the other part too, is they still have the isolation. Yeah. They still have to isolate up there because you know what, that's bad enough, you're going to be up there. If you don't have the option of buying a house in town, even if that's where you want it, you don't have that option because this is only a place you're not buying a house.
I know I was like surprised, you know, Desiree? Yeah. I always go over to her place, but like her reserve is like literally a minute out of town. Yeah.
That's a swimming reserve, yeah.
Yeah.
That's like the closest one into town and I was shocked. I was like, wow, this is the closest one, and I think because back then it wasn't probably as close because the train around there has been really okay, let's just pop here.
Yeah, because I live on Bank Street and I know that's like a big development.
Yeah. It is, you know, and all those things, and it's so frustrating. It's like, you know, you see the stuff that they supposed to do and they come off reserve, and you know, it's supposed to be getting better, but it almost seems like it's getting worse. And now you see kids, young kids now are out there doing like X and that, and everything around is like, wow, great, look at all this stuff on and they don't know. And you know, what are they to do? They'll have programming on the weekend, but for the rest of the part, they don't have gym night. They don't have like things for these kids to constantly be doing. And it's sad because it's going worse, and then not only the kids, but their elders too that are getting the care that they need. Like getting the supplies that they need, or you know, people get served every day, and your only gets it twice a week. I tell you, it's like when you're else twice a week. And it's like twice a week, and she gets 2 baths. And that's like, you know, it's sad because like the way they're treating them, and that's what my like our chief is trying to change now. But you know, it's not as easy as you think to change because of people do all this stuff on the government and stuff just to get one and looking down. My daughter came to me yesterday, she's doing homework. And she taught us to do really good and explaining like diseases and stuff like that. She won't be able to give her an assignment. And I said, well, to me, it almost seems like this person is living as a because it was like constantly, this person was going back every day in his mind, doing something. And then she CBD, right? Like, same exact steps every day. So that's what I told her. So she wrote that down as one of her answers, like, this is what I did. And the teacher, like, accused her of copying that. Like, I was like, are you kidding me? And then I said, you know, this is crap. And she accused her of everything she wanted on paper. She said it was all online. And it came from her head because we don't have internet access. And I'm like, for all of me, I want to rate her. I'm like, you know what? Excuse me. Some people have brains and some people. And I said, and that's research on her part because she said, Mom, this is what I'm wondering. What kind of person is this? What would you describe this person as? And to me, that's research. That's part of how you're going to find your answer. You ask somebody. So if she doesn't think that that's right, then she and then she doesn't want me to go see the teacher. I'm like, no, that's wrong. I said, because that's going to screw up. I said, what happens if you get charged with plagiarism? That's going to stay on you for like 3 or 4 days school, and because she's a great friend now, I don't want that on the record. I'm not sure. Yeah, I'm not sure which one it is. Tell me. That was the thing. I'm like, tell me who it is because I'm like all down, like, you know, mom, they're coming in, right? Like, I don't think kids should be accused of stuff, especially when she's doing it on her own mind. Like, she's that smart. But she like, no, you just copied it all offline. And we see her, like, she came in the room and she's like, well, she came in and she started asking me questions and I started telling her and she was describing what it is. So then that's where she got her idea, was to that's what it is, so she wrote it down. You know, not only just that question, it was a few others where she had done her own research in her, like, thinking about her, reading the book over and over and over, and gathering her own information, and then even then to be accused of copying it off. Yeah. But it's trying to get her to understand that you have to speak up for yourself, because if you don't speak up for yourself, then the teachers are going to, you know, continue that with other kids, and other kids maybe not as strong as somebody else to say something about it. Like, you know, this is what's happening.
Somebody had power yesterday. She's like, yeah, when you kind of get somebody blame and you say sorry, but it's not really your fault. You have nothing to be sorry for. Yeah. I was walking through the door at the gas station today, and I was looking to the side, and oh, I'm so sorry. And I kept walking.
Yeah. I noticed it did the same thing when we were at Walmart last night, and just go bumping into somebody. I'm like, oh, I'm sorry. Like, and then I walked in, like, what am I saying sorry for? Like,
Or how yesterday she's like, you're just being like kind of backing down if you turn your back away from somebody. But like yesterday, Lisa and I got into the yeah. I was like, I'm gonna start saying not very nice things, and I have to be with you until November. Like, I'm turning my back on you. I wasn't backing down. I just knew it was smarter on my behalf to let it down there.
I don't know which one she is. Is she the one who's like,
Yeah. The one with the squeaky shoes. Yeah, her and I got into it.
There's something about her I just don't like. Like, I feel that it's like almost like because you did your LPN, you know more than you know. She has that attitude that you just really. Wow. That's not cool. And she was fired, and it's like, you know, you need to rethink what you're doing. Like,
She has no love for the residents.
that's not cool. That's heartless. Like, those are the kind of people I'm going to rip up and down.
And I have to sit beside her every day, knowing all of the stuff I know about her.
Yeah.
And she sits there and she's like, do you think she was a real sweetheart?
Yeah. Her daughter's amazing. Like, you know,
I know.
it's amazing.
And when Kayla first started out, I got this house, I was like, I don't want Kayla working here. Like, yeah, I want another one of them. And then I worked with Kayla, and I just thought, like, where did you come from? Like, who raised you? Because you're nothing. Like,
Yeah. And she did a lot of impersonation stuff in the school too. She's like, I just love it. You know, like she was there, she'd ask me like all I do things. I was like, you're more, and she like learned the language too, right? And I was like, you're more native than I am, for God's sakes. She starts talking about her enthusiasm, her life, and First Nations and different cultures. She's so open, and I think that comes from her grandparents. Yeah, I think that's where that comes from, because I don't see it. I did notice that there was something different about it. It's like I couldn't pinpoint what it was. It's like, and it's like, what exception? I thought it was just me, and I'm working with her. I'm like, holy, like, really? You know, like, trying to do all my stuff. And like, getting into the fight. I thought it was just me, you know. She was, you know. And I just like, yeah. You would never know that about her. Just like how she is right now. Like, all those things that she treats people that badly. Yeah. That's why she's not buying one. That's not cool. Yeah.
Well, really, at the end of the day, you're just stealing from the residents.
Oh, yeah, you're still going to be here. Oh, yeah. Exactly.
Go ahead.
Going for a quick break. Okay. I hope you ate something.
I did. I had a half a sandwich. Some other treats.
Did you know she's having a baby?
No? Really? That's so exciting. Oh, that's awesome. When do you do?
January.
Yeah. January 20th? Oh,
That's what she's speaking.
oh, awesome. Good for you. Is that exciting?
Very. Her second one.
Your second. Awesome. How was your first delivery?
It was fast,
Mm-hmm.
easy, and it
Good.
was all natural.
Mm-hmm.
Do you follow cultural practice for yours? Do you like follow your cultural? As it is.
As it is, right? So where did you have the baby, the first baby? Seminar.
Yeah.
And now you're living here? And they do deliveries here and there? All I can say to you is you make sure you get in there early.
Yeah.
If your first baby was not a problem, your second baby usually is a lot faster. So
Oh, yeah.
yeah, just make sure maybe you go in a day or two before or whatever.
7.5
Get there.
hours, certainly.
Oh my goodness, girl.
My one cousin, she was 20 minutes. She was like sitting there, and all of a sudden she's like barely made it to the American hospital from Hawaii. And the baby was on the way up, and the nurses there were like, oh, like
Oops,
they never had to deal with it. It's not as common now, right? So they're freaked out. And she's like, hello, my baby's coming out. And the nurses are like right now.
Well, they shouldn't really, you know. Not versus well, actually, that's my favorite. I love it, and that's where I went after training. And I did a lot in training. I did my senior year in training, in maternity. So I just think it's the most awesome place to work. But yeah, I mean, it's a natural thing. It's not supposed to be, you know.
Well, I think it was because she was so fast and they were in shock.
Yeah, they were prepared for it.
All of a sudden, the baby's head is coming out there.
And I always say to my students, listen to your mom. That doesn't matter whether you've done a pelvic and you know how far she's dilated. You listen to what she's saying, because people can go from like 5 to fully in a few minutes. It just depends on their body, right? And if you don't listen to your mom, then that's what happens. You know, you're surprised the baby's on the way, right? You're not ready for it. Yeah, that's exciting. I would certainly be prepared, though, to have a home birth. I mean, I don't want to scare you, but I would be thinking about it. Yeah. No, I meant if you can't make it to the hospital, that's some preparation of it.
Oh,
for
would consider high risk.
Mm-hmm.
Yeah, I had preeclampsia with my first one.
Oh, so you probably will be in hospital before the due date. Oh, that's good though, because you don't want to just like have a surprise at home.
Yeah,
Here's the baby.
with my first one, I saw the doctor the day before, actually.
Right.
She's like, I just saw you yesterday. You didn't even drop. You really bad.
Mm-hmm. Mm-hmm.
Like, you don't know where to go.
Yeah. Right. Yeah.
She's like, I'll just come in and have a look anyway.
Mm-hmm.
Yeah.
Wow. See, doctors don't know everything.
She said that I was the first one, or she witnessed
Mhm.
to be the first one to be quiet in the hospital when I was
Yeah.
screaming or anything.
Yeah, right.
She's like, is that even normal?
It is for some people and for some cultures too.
Yeah. They had a contraction on me.
Mhm.
And
Yeah. That's awesome. Oh, I wish I could have done that. That's pretty good.
Like she was mean, and it was when they still did the research in there.
Mhm.
She was like, fuck you. She was
Yeah.
mean. I was like, oh my God, and my cousin was like, that what a baby sounds like when you have one. That's what it's like, I'm never having kids. She was like terrified. I'm like, oh my God, it's like, I don't think it's like that, because I didn't have a kid myself at the time. Like, that doesn't sound very fun. And she's like, just relax, Teresa. And my cousin's like, fuck you relax, tell you have a big. She goes,
It might be taping. Be careful what you're saying.
But it was fun.
I don't know sure whether it is or not. I'll just be careful. Anyway, yeah, so we'll go on with the muscles and the muscle tissue. And I have not got rid of those things. Hang on a second. Sorry, I have to fix that. Okay, so we're going on to muscles. Now, the muscles are, this chapter's not too bad, except when they get to the chemistry part. And hopefully I can stop and we'll discuss that thoroughly. And in this PowerPoint, I've put in a review, so hopefully it won't be too confusing. Stay there. Okay, so the muscle tissues, types. The primary are skeletal muscle, cardiac muscle, and smooth muscle. And of course, the name just explains the cardiac muscle is in the heart, and the smooth muscle is your intestines, right? And small vessels. So muscle tissue is specialized for one thing, and that's for contraction. We won't talk about uterine muscles. That's another type of contraction. They are specialized too.
I think it's exciting.
I do too. I love babies. I love babies. I love moms.
I just want to make one week excited for you.
Yeah, we'll all get excited. I'll be waiting to hear.
Yeah.
Okay, good. Carry on. Okay. So skeletal muscles, which makes sense, are attached to the skeleton. That sort of makes sense. Allow us to move and hold the bones in place and maintain body position. So even though we're not moving, the muscles are still working to maintain us in a posture. So they are always working in a way. So they support the soft tissues, which means they support the abdomen, all of the organs that are inside the abdomen, the abdominal and pelvic floor, your bladder, your bowels, and all that. They support them. They guard body openings, meaning they have sphincters. So you have sphincters for the rectal area, of course. You also have sphincters that are inside your stomach, which hold both ends of your stomach. So when the food goes down, each end closes, and the stomach mixes the acids and enzymes with the food, and then it opens at the other end to allow it to go through into your intestines. Maintains body temperature, and body muscles contract and produce heat. So you're out in the cold, you've been out there for a long time, of course, what happens is you start to shiver. So those muscles are shaking, they're actually producing heat, so they're doing their job for that. But just moving and, well, when you jog or when you do anything like that, of course you get warm, so they do produce heat. They store nutrients, They store amino acids, and they're used for energy when the diet's inadequate. The storage of amino acids, the storage of is important when you get into diabetes, because if you don't have enough insulin in your body, and you'll be going through this in your other classes, the body starts to break down muscle and fat tissue because it can't get that sugar in. And so you get what you call ketones in the urine. And that's one way to tell if diabetics are having problems with their sugars. They'll get ketones in their urine. And that's from the breakdown of skeletal muscle and fats. Like I said, you're going to hear all about that in your next class. So the structure of the skeletal muscle, the muscle tissue, each cell is called a fiber. It has connective tissues with it. So you have the epimysium. So epi is always the outside cover, right? This is the epidermis, epithelial, that's always the outside cover. So the epimysium is the outside cover. Perimysium is an inner layer, and the endomysium is inside of these tubules. And you'll see that again, because it's going to be repeated. Has nerves and blood vessels in the skeletal muscle. That there? Epimysium, the layer of collagen, and it surrounds each muscle. So you can see here, well, the muscle tissue, the muscle here would have a layer of collagen around it, and that would be the epimysium. It's connected to deep fascia. Now we're going to talk further about fascia, but this is the fascia, which is the white area there. It separates muscle from surrounding tissue as well, and that's what the epimysium is. Perimysium, the next layer, it surrounds the bundle of muscle fibers, or fascicles. So I keep calling them popsicles, but that's wrong. Fascicles, okay. So that's the bundle, which would be this bundle in here. Perimysium supplies blood and nerve impulses to the fascicles. Endomysium surrounds individual muscle cell fibers. So you can see here in the picture that there is a fiber here and it's surrounding those. It also contains blood vessels, capillaries, and nerve fibers as well. And it has satellite cells, which are stem cells, which are your repairing cells in your body. For stem cell transplants and all sorts of things like that. So they have their stem cells for repairs.